So I'm in the middle of a chemo treatment. I'll get disconnected about 9 o'clock tomorrow morning. I was outside doing my laps around the house. I usually go outside about every hour and a half to 2 hours, just walking it off. The body definitely tells me I just need to sit in a recliner for a couple of days, but honestly, I feel so much better if I just force myself to get out and just do some walk arounds. I was walking around, but the camera shot got a little too shaky, so I decided to sit down for a minute. Doing fairly well. Have another chemo session in about 2 weeks before we go to the Mayo Clinic on November 14th. I think we're heading up to the Mayo Clinic to do more scans. I'm not really sure what we're going to do at that point. The majority of the tumors that were in my good lung are stable, but there was one additional one that seemed to be growing even through chemo. So if it's getting bigger, we'll probably have to do some kind of surgery, but we'll figure that out here in about a month or so. So in the meantime, what I've been trying to do for the last 2 months is try to get into this phase 1 clinical trial that my oncologist at the Mayo Clinic is pretty excited about, specifically for the type of cancer that I have. The problem is it's only in about 7 different places in the world, and only about 3 of those places I really want to go to. So I tried MD Anderson out in Texas, no room. Not, all the slots are taken. The second place that I tried was Johns Hopkins in Baltimore, no room. All the spots were taken. And the third place that I've been trying is Sloan Kettering out of New York City. Now, I've called them multiple times, and many promises have been made. They'll call me right back, call me within a day or two. Nothing at all. So it's okay. Like, it's just a phase 1 trial. If they see success in that phase 1 trial, they'll expand it to a phase 2 and invite more patients in. So, we'll just kind of pursue that. So my job now is just to keep battling, make sure that I'm available to be in those phase 2 clinical trials. So that's that. So the next thing I want to talk about, I'm about to get away out of my comfort zone. I'm sure I've said on these videos, or maybe I've talked to you guys personally, I really don't like making these videos, never like to be the center of attention. It's not really my thing. Sorry if you can hear the dogs behind me. I'm going to start doing, I just opened an Instagram account yesterday. And the reason I did that is because I want to make more videos, primarily for the reason I needed to hold myself accountable. I can tell you for the last month, my focus has been work, which is fine. Like, I work with a great bunch of people, just trying to strive to get better at my job. Our team is trying to get better. But what I've been doing is not focusing on me and my battle. 100%. Like last year, if Sloan Kettering was ignoring me, 100% I would have went for a drive and been knocking on someone's door and having a face-to-face conversation instead of playing this phone tag stuff. So I kind of need to get back into that mode. So the Instagram is going to hold me accountable for that. But on a bigger note, like, I have conversations every day with strangers about my cancer battle. I'm like, there's some good stuff in there. Like, I know there's good stuff that I can share. I've been doing this a long time. I feel like this is my 35th treatment. I might be off 1 or 2, but I think it's 35 treatments. So I've been doing this a long time, so I can share a lot. So that Instagram is going to be out there. Had to hit the pause button for a second, got distracted. But anyhow, that Instagram account. So I know absolutely nothing about Instagram. Nothing. Just literally opened the account yesterday. So it's going to be horrible for a while. And honestly, it might be horrible for a long time. I'm sure the lighting will be bad. I don't plan on editing. I'm just going to record, post, and be done. I'm sure the audio is going to be bad. And you know what? It's going to probably be bad forever, and that's okay. My goal is not to get good at this. My goal is to get better at beating cancer. So if that's what we need to do, that's what we're gonna do. If you want to be part of that journey, where I dive deep into it, I think the Instagram account is called Embrace the Suck _ my cancer journey. I'll have a link in this post. So that's it for now. I'm sure there's a bunch of other stuff I wanted to say, but it is what it is. See you next time. Maybe tomorrow if you join up on the old Instagram.